Hi there. In this video, I want to talk about cartilage and meniscus tear. Hi there, this is Elbu, your exercise physiologist. So regarding meniscus and cartilage tear, a lot of people come and they ask about things regarding cartilage and meniscus tear, and the very first thing that they will tell me is that they suspect that there's some tear in there, and because it's inside the knee, and when they try to Google and when they try to find things online, that is the only thing that they see, and they think that there is some problem there. So back to questioning them and to understand what's happening. Meniscus tear and cartilage tear usually requires some form of impact. So when there is some impact, you think about bone hitting bone, or usually accidental. The impact is usually larger. You look at athletes, sports player, they have to get into a very awkward position before they get something tear or torn around the knee. So this is what they suspect, and the only way and the only confirmation to let yourself know that there is something that is torn over there is basically gonna be X-ray or MRI. This kind of imaging can confirm that there is some tear inside. So there are also instances where the tear is not contributed by accident, or it's not contributed by it's not even a problem to start off with. Let me explain. So a lot of times people tend to load their knees on one side and then the other. You think of it more of taking a hammer and you're trying to knock on a piece of wood, right? So when you keep knocking and knocking and knocking, for the first few times to multiple times, many times, you don't get into trouble. But over time, you will start to see that there is some dent or there's some damage on the wood. Now, you may feel pain around there, but my question is it that the wood has got some problem, or is it that the knocking has got some problem? Which is the one that is giving you the problem? Because if we are just going to fix this, which is your cartilage and your meniscus, you've gone through some surgery, which is going to take like a month to 3 months, depending on what kind of procedure you go through. This is fixed. This is okay. 1 month and 3 months later, this is perfect. You have already changed your parts. But this hammering continues, right? So after a while, this is going to happen. So firstly, you need to find out what is happening that is causing this. If you have gone through some accident, if you've gone through certain things that has caused this to happen, then yes, surgery may be the best option. But if this is happening and you are always loading something onto that area, and this is always pounding over time, then you got to fix this. This happens when the bone, and the bone, which is your femur bone and your tibia bone, is actually getting all this. That in between is basically your meniscus and your cartilage. Okay, so this pounding happens. The first thing that is going to get it is going to be, of course, your meniscus and your cartilage. When this happens over time, then you get that, and when you go and go for your imaging, that's what you will find. But most people or even your other knee, why is it that this is not happening? What's wrong over there? Something that you may need to ask yourself, and I can just quickly tell you the answer. You don't have to go and Google and find out. Your muscles are not working properly. It's not taking the load, and hence the load is going to be on the knees. When the load is on the knees, that is why and how you get your tear in your meniscus and your cartilage. That is the reason. So think of your other knee. If it is also giving you the problem, or even when you go for a scan, there is some tear, but you're not having the pain, then you need to start questioning. Because a lot of times, and there are also research that has already shown, the imaging and the MRI doesn't tell you how and why you get into the problem. It only show you that that is happening. That is that, and period. Nothing else. So, well, you first may be guessing that there's the meniscus tear, right? So if we take this out of the equation, if it's not the meniscus and the cartilage anymore, then you got to look at your muscle. You have to get someone to look at you to understand what is going through, what kind of movement you are doing, to then analyze why you're having the problem, because there are many other muscles around the knee that can contribute to this. Okay, so answered. The time that you're going to take when you go for surgery, the recovery time, and the problem may exist not because of the tear. So stop guessing. Go and find somebody. Ask yourself these few questions first, because you're not going to help yourself if you just wait for the thing to recover. This is not going to recover. This thing is always going to be there. Okay? So even if you have how should I put it? So resting may sometimes help, but you don't know what's happening, right? You may rest and this is not going on, but when you start to do something again, this may happen. So whether is it that you go for your surgery, whether is it that you go for your rehab, whether you find someone to help you to check, you need to understand that this happens for a reason. And the reason is the very important thing where you need to find out so that you can get it fixed and then you don't get into the problem anymore. Some people don't go for surgery. The tear is still there. They can go for MRI and X-ray and they can still see something there, but they have no pain. That is all I have for you today. Please take care and try to find some professionals instead of guessing what is happening in there, because you may be wrong. And if you're assuming, there's a very high chance that you are wrong. I'm not trying to fault you, but because you are just trying to Google and you are just trying to find the things that you think you know. Of course, whatever you type in Google, it's just going to show you. I'm putting this video up so that you know that the problem may exist, not because of whatever that you typed over here. There may be something else. So please look up on some of my other videos so you have better understanding of what could actually happen around your knee. Please take care. I will see you soon. Bye-bye.